If you've ever had low back pain, or know someone who has, then you know it can be confusing, frustrating, and even a little scary. Well, in this explainer, we're going to cut through all that noise. We're diving into a major new research review that is completely changing how we think about low back pain. Let's get right into it. First, just to get a sense of the scale we're talking about, in 2020, about 619 million people around the world were dealing with low back pain. That is an absolutely staggering number. It's actually been the leading cause of disability worldwide for more than 30 years. And here's the thing. This isn't a problem that's just going away. By 2050, that number is projected to jump to over 840 million people. So you can see why understanding the latest science on this is just so important. Not just for doctors, but for all of us. So here's our plan. We've just touched on how universal this is. Next, we're going to tackle some big questions. How worried should you be? Do you actually need that MRI? Then we'll get into why embracing the unknown is so important. And finally, what the real story of recovery looks like. All right, let's jump into our first big topic, red flags versus reality. This really gets to the heart of the anxiety that so many people feel, right? That little voice in your head wondering if the pain is a sign of something really bad. It's a totally natural fear, so let's look at what the evidence has to say. This chart is, well, it's incredibly reassuring. When doctors first look at back pain, they sort it into a few categories. And look at that tiny little slice. Only about 1% of cases are caused by a serious underlying condition, like a fracture or an infection. The other small piece, radicular syndrome, that's usually nerve-related pain like sciatica. But the massive piece of the pie, 90 to 95% of all cases are what's called nonspecific. And this quote from the research just nails it. You know, you can go online and find these terrifying lists of red flags. But what the science shows is that any one of those flags, all by itself, doesn't mean much. The real key here is that clinicians are trained to look at the whole picture, a combination of things, not just one isolated symptom. This brings us perfectly to our next big question, the problem with pictures. It seems so logical, doesn't it? If my back hurts, let's get a picture, an X-ray, or an MRI to see what's broken. But it turns out the story is way more complicated than that. This is really the million-dollar question. We all assume that a scan is going to show us the reason for our pain, the one thing we can point to and say, that's it. But does it? Okay, this right here is probably the most eye-opening discovery in all of back pain research. Things that sound really scary on an MRI report, like disc degeneration, disc bulges, or wear and tear, are incredibly common. Yes, we find them in people with back pain, but here's the kicker. We also find them all the time in people the exact same age who have absolutely zero pain. It's kind of like having gray hair or wrinkles, but on the inside. They're often just normal signs of aging, not necessarily signs of damage. And because that link between what's on the scan and what you feel is so weak, major clinical guidelines all around the world now advise against routine imaging for most back pain. The research shows it doesn't help people get better faster. In fact, sometimes it can lead to more worry, more unnecessary tests, higher costs, and even longer recovery times. Okay, so if the pain isn't coming from a single broken part that we can point to on a scan, what's really going on? This is where we have to get comfortable with a bit of uncertainty. And trust me, reframing this is the secret to getting better. Let's go back to that 90 to 95% of cases. That's what nonspecific low back pain really means. And it's not a lazy diagnosis, it's an honest one. It means your pain is 100% real, but we can't pin it on one single structural issue. Instead, the pain is influenced by a whole bunch of things, muscles, nerves, and even our stress levels, sleep, and overall health. So once we accept that, it leads us to the most important question for both patients and their doctors. How do we talk about this pain in a way that actually helps, instead of making things worse? This table is gold. It shows how powerful our words are. Hearing your spine is worn out sounds like a permanent problem, right? But hearing that these changes are normal for your age, well, that's empowering. Instead of being told to stop moving, the advice becomes about getting back to natural movement. It's all about validating that the pain is absolutely real while building a plan and the confidence to get better. And that brings us to our final and maybe the most personal question of all. What can you actually expect? What does the story of recovery for back pain truly look like? We tend to think of pain in two simple boxes: acute, meaning it's new and will disappear, and chronic, meaning it's here to stay forever. But it turns out that's just way too simplistic. It's not the reality for most people. Instead, pain follows a bunch of different paths. Sure, some people have one episode and get better fast. But for many others, it's more like that middle line. It fluctuates, it comes and goes. You have good weeks and bad weeks. And the most important takeaway here is that even for people with persistent pain, the line isn't flat. Chronic does not mean your pain is permanent or can't get better. So what's a more realistic outlook? Well, when you have a new episode, getting a lot better in the first few weeks is actually very common. Flare-ups or recurrences are also really common, and they are not a sign that you failed or broke something again. And most importantly, even if you've had pain for a very long time, improvement is always possible. This quote really brings it all home. The best way forward isn't an endless hunt for a broken part. It's about accepting that the cause is complex and shifting our focus to the things we actually can influence: how we move our bodies, how we manage stress, how we sleep, and how we slowly get back to doing the things we love. That's what builds a truly hopeful path to recovery. So we'll leave you with this to think about. Knowing all this, that pain doesn't always equal damage, and that recovery is a journey with ups and downs. How can this change the conversation you have about your pain? With your doctor, with your family, and maybe most importantly, with yourself?